Many people do worry about coughing and sneezing during eye surgery, but in fact, in my experience, conducting maybe well over 1,000 operations per year, I rarely encounter this in theatre. Most people are able to control this during surgery. Those patients who have an active problem, such as a cough or a cold, immediately before the operation, we should be able to identify that and either defer their surgery or offer some medication to try and manage it. If you do feel like you want to have a cough during the operation or a sneeze, just squeeze the hand of the person who is holding your hand in theatre, and that allows me a little bit of time to make sure that your eye is kept safe during that situation.